When looking at this picture, what thoughts come to mind? Not only does it give me a sick feeling in my stomach, but it is also a harsh reality of what many mothers inflict upon their unborn child. Aristotle once said, "Foolish, drunken, or harebrained women most often bring forth children like unto themselves." Fetal alcohol syndrome is the result of the consumption of alcohol during the 9 months of growth inside the mother's womb. Up until the late 60s and early 70s, it was thought that the likeness of fetal alcohol syndrome was due to was a result of a poor genetic pool. At this time, researchers discovered that the similarities were in fact due to the fact that the mother had been consuming alcohol during her pregnancy. Fetal alcohol syndrome is one of the top 3 causes for mental retardation. Many women also believe that there is a safe amount of alcohol that can be consumed during their pregnancy. This is very untrue. Although only 10 to 40% of children of alcohol-consuming mothers will have fetal alcohol syndrome, there are many chances that these children will also have other problems if their mother is consuming alcohol during the pregnancy. Binge drinking is by far the worst style of drinking that a mother can do while she is pregnant. It is worse because the blood alcohol content is higher at short periods of time rather than lower at long periods of time. I first discovered fetal alcohol syndrome while working as a nurse aide at Sanford Hospital on the postpartum floor. It is very devastating to see these children that have to go through this for the rest of their lives because of their mother's choice. Diagnosis of fetal alcohol syndrome is met by 3 areas of criteria. The first is by specific facial anomalies. In this picture, you can see some of the anomalies. Starting off, many children will have a smaller face and head. They will have epicanthal folds, which are folds in between the eye and the nose and fold over on top of their eyelids. They will also have a flat midface or hardly any structure to their cheekbone. They will have a smooth philtrum, which is also known as the vermilion, which is the bumps that most of us have above our lip. This will be a smooth area. They also have an underdeveloped jaw, a thin upper lip, which sometimes is not even visible, a short nose, and small eye openings. Sometimes the children may also have anomalies on their ears, which also can lead to the idea that there is something wrong with the brain since they develop at the same time. One of the other areas that the children must meet to be diagnosed with fetal alcohol syndrome is the growth deficiency. These children usually lie within the 25th percentile, and they usually remain small until they hit puberty. These children will also have issues with their central nervous system, which include the physical difficulties, which usually include microcephaly, which is issues with the brain. The issues with the brain would include that the brain is much smaller than a normal child's brain, and it is also much more undeveloped. They also have behavioral issues, which include mental retardation and a lower IQ. There are some challenges with diagnosing this disorder because if not all the symptoms show, they cannot diagnose it as fetal alcohol syndrome. Finding treatment and prevention is also very difficult. There are very few known treatments for fetal alcohol syndrome. Usually if the child is receiving treatments, it is for other related problems, such as hyperactivity or motor problems. In order to prevent this from happening, it would be better if they had better warning labels for mothers to read on alcoholic beverages. Also, they use early case management work in doctors' offices to help prevent high-risk mothers. In Seattle, Washington, they have a program called Birth to 3 program. This is for high-risk mothers that they have someone come into their home and meet with them when they find out that they are pregnant so that they can follow along and make sure that the mother is making the right choices. They also set them up with different area programs to help them make sure that the child is getting what they need. Fetal alcohol syndrome is a devastating disease that is happening far too often for as preventable as it is. The way in which it affects children both physically and cognitively is a disturbing reminder of how important it is that mothers do not consume alcohol during their pregnancy. Even though many children do not see the full effects of fetal alcohol syndrome, if their mother only consumes a few drinks, it can still affect their full potential.